Hello everyone, I'm Fiona Lang-Sharp, IBCLC and Public Relations Coordinator for GOLD Conferences. Welcome to our GOLD Lactation Online Conference for 2014. I'm here today with Nils Bergman, and we're talking about his presentation up and coming at his preterm session. Understanding Resilience, Why a Preterm Needs Its Mother. And I must say, Nils, I do love that statement, why a preterm needs its mother. It just sounds so forthright and straight. And so I'm really looking forward to hearing your full presentation. But let me start by asking you some questions. I want to know more about how you really got first involved with this type of work.
Thank you very much. Well, it started way back in 1988 when I started working as a mission doctor in Zimbabwe. And we had heard about the kangaroo mother method, is what they called it in Bogota. And it was skin-to-skin contact. What we did, though, because we didn't have any incubators, is that we used mothers as incubators. And we saw amazing results. So it really started in a very, very rural environment without technology.
Well, that certainly is a very wonderful statement, because if we think in terms of what we're doing today in our hospitals and how we are always having to promote skin-to-skin, this started, as you said, out of a necessity where there was no technology, and we needed to turn back and look at what we had, and that, of course, is we had our mothers. So can you tell us some more, perhaps speak to our delegates now and tell them what are they going to be learning from your presentation?
I'm going to provide a more scientific rationale towards the nice sentence that you liked, based on neuroscience, based on evolutionary biology also. This mother that we used instead of incubator turned out to be a much better incubator than the ones that we've used for 100 years. Now, there are good reasons for that. I didn't know these 20 years ago, but those I'm going to try and explain in this session. There is a epigenetic basis, there's a neuronal basis, there's a behavioral, physiological basis, and a developmental basis that ultimately has emotional and social consequences. The preterm needs its mother for many reasons.
Well, that sounds fascinating. And you know, Nils, I mean, I'm a big fan of skin-to-skin and contact with the mother, always promoting it myself. But let me tell you that just in listening to your conversation right now, you've just piqued my interest even more. I'm trying to take notes and hear what you're saying at the same time. The epigenetics, the neuroscience. Wow. Okay, so you've got my attention. I'm very excited to hear your presentation now. So lastly, before we go here, can I ask you, what have you seen in terms of changes as you've been using this method, and what are the outcomes from your personal point of view?
I think I could answer this at many levels. Certainly, when you work with a little baby that's 26 weeks, 24 weeks, and he or she opens his eyes and can focus on you, it's quite scary. It makes your hair stand up. But changes that happen, those eyes profoundly alter parents. And what we're seeing, my wife Jill and I, as we work together, is that parents are profoundly altered by this early skin-to-skin contact. And with it ultimately, what we hope to see, but have yet to see really to the scale we'd like, is that health systems take this on at a different level of scale. So that, I think, will happen after this talk as you're able to disseminate this information. So I'm very thankful to you.
Well, thank you, Nils. Well, we know that your presentation is jam-packed, so for all of you listening out there, you're in for a very exciting ride, I know for sure. So please tune in to listen to Dr. Nils Bergman and his topic, Understanding Resilience, Why a Preterm Needs Its Mother. So thank you again, Nils, for spending this time with me, and thanks to all listeners for tuning in with us today. Thanks, everybody, and have a great day.